Morning, everyone online. So it's a real pleasure for me to be here today, and I'm really excited to get to speak to so many people that have an interest in this important and really under-recognised disease. And I'd like to just start by thanking Graham, Lauren, Beth and Chris from our CARES team just for everything they've done today to put together the programme. I'm sure you'll all agree that I think we're going to be able to learn a lot from each other today, and I'm certainly looking forward to hearing from our patients later. So the title I've been given for my talk today is Who Gets Aspergillosis? And I think probably I need to begin with a little bit of background to start with. So going back to basics, what is Aspergillus? Well, Aspergillus, it's a fungus. It is described as being ubiquitous, and that means it's found everywhere. It's found really most abundantly in the soil and kind of decomposing leaves and vegetation. But it's also in the air that we breathe every day, and it can be found in places throughout our homes. It grows best within damp, moist, warm places. There's a lot of different species of Aspergillus as well. But Aspergillus fumigatus is the species that most often causes disease in people. So then what is aspergillosis? Well, this is the name given to a group of medical conditions caused by the fungus Aspergillus. And there are many different types of Aspergillus, such as Aspergillus bronchitis, chronic pulmonary aspergillosis, allergic bronchopulmonary aspergillosis, invasive aspergillosis, and just airway colonization, which has no disease associated with it. So this is just, as I say, a group of conditions with the overarching name aspergillosis. And aspergillosis itself is not a diagnosis, and it's important that people are diagnosed with the correct conditions so that they can be treated in the correct manner. So then moving on to the question of who actually gets aspergillosis. Well, I think it's important to first of all understand the structure of the lungs when thinking about the different types of aspergillosis. So the lungs are made up of the airways, which include the main windpipe called the trachea. And then the airways become smaller and smaller as they move out towards the periphery of the lungs. And so they move from being called the trachea down into the bronchi and then the bronchioles. At the end of the bronchioles are what are called the alveoli. And this is a bigger picture of what the alveoli look like. And alveoli are where the real work of the lungs take place. They're small air sacs and they're covered in tiny blood vessels called arterioles. And this is where oxygen is picked up and then taken back to the heart and pumped out to the rest of the body. So these are really important parts of the lungs. So this helps us to think about the different types of aspergillosis. Allergic bronchopulmonary aspergillosis is an allergy to Aspergillus in the airways. It's not an infection. Chronic pulmonary aspergillosis is a chronic destructive infection of the lung alveoli themselves. Invasive aspergillosis is an infection that spreads from the lung tissue into the bloodstream and can cause widespread organ infection. And it's really important to know that this happens in patients that have a significant suppression of their own immune system. And then finally, Aspergillus bronchitis, which was really only coined around 10 years ago as a condition and recognised, is a localised infection of the surface of the bronchi. So who gets ABPA? Well, this usually occurs in patients with underlying disorders of their airways, such as asthma or chronic obstructive pulmonary disease, COPD. These patients have unusual airways, which are often thickened and they have a lot of mucus within them. And this mucus is able to trap Aspergillus And then these patients often also have underlying allergies to common things such as hay fever or maybe house dust mite, animal allergies. And the exposure to Aspergillus in the airways prompts an allergic reaction to it. And that allergic reaction then leads to more production of mucus within the airways and damage to the airways. A further important group of patients that gets ABPA is patients with cystic fibrosis. And it's much the same in that they have really abnormal underlying airways which are filled with thick mucus. And these patients also have quite a tendency to general allergies. And then lastly, there is undoubtedly a group of patients, which is rare, but we do see at our centre, where we do not identify any underlying condition that has precipitated the allergic bronchopulmonary aspergillosis. Sometimes we will detect mild allergies to the other environmental factors, but sometimes we don't come up with much at all. And those patients are certainly ones that we like to investigate and try to understand what has led to this condition. So the symptoms of ABPA. Well, one of the big difficulties with ABPA is that the symptoms are often not much different to those of the normal condition underlying it, such as asthma or COPD. The onset is usually over weeks to a few months and consists of a persistent cough, coughing up of really thick plugs of sputum, which can often be seen as almost outlines of the airways themselves. Breathlessness and wheezing is common, as is chest pain and sometimes fever. These symptoms come and go over time and often relapse after treatment. And this is usually a lifelong condition once it has started. So moving on to chronic pulmonary aspergillosis, who usually gets this condition? Patients who get chronic pulmonary aspergillosis usually again have an underlying lung condition that has altered the structure of their lungs. The most common underlying condition is emphysema or COPD. And that's because this condition leads to a breakdown of the alveolar walls. And this leads to kind of larger floppy airway sacs, which cannot effectively remove the normal bacteria and fungi that we inhale every day. And these can then get stuck down within the airway sacs. And as I said before, Aspergillus really likes a kind of moist environment and warm with lots of oxygen. So the lungs are really perfect for it to grow. So this emphysema affects around 30% of our patients that present with chronic pulmonary aspergillosis. The other and second most common underlying disorder has been a prior diagnosis of tuberculosis. And that's because tuberculosis, as an infection of the lung, can lead to quite significant destruction of the lung alveoli and tissues, which can leave cavities and holes within the lungs. And these holes within the lungs are a great place for Aspergillus to get into and find a good environment to grow. So this again accounts for around 30% of patients who present with CPA. 15% have had what's called a prior pneumothorax or collapsed lung. And this tends to be patients who have required either surgery or what we call talc pleurodesis to stick the lung back up, leaving some damage to the lung, which seems to be associated with chronic pulmonary aspergillosis development. And then around 20% of our patients have got the condition bronchiectasis. Bronchiectasis is where the airways themselves become larger than they should be. There's quite a lot of different types of bronchiectasis, and the different types really describe how these airways look. But ultimately, the airways become larger, thicker walled, and they contain lots of mucus. And that mucus, again, can trap Aspergillus. And because of the way that the airways and the air sacs are, is you can begin to get the formation of fungal balls within these areas, leading to chronic pulmonary aspergillosis. There are many, many other types of lung conditions that we come across that patients have had prior to their diagnosis of CPA. And these include things like sarcoidosis, prior lung cancer treatments, rheumatoid arthritis, lung fibrosis, and some patients who are on medicines that suppress their natural immune system, or some with inherited conditions that lower their immune system from working properly. So what are the symptoms of CPA? So the symptoms are definitely more chronic and come on in a more kind of insidious manner over usually around 3 months. Symptoms can consist of a cough, the coughing up of blood, breathlessness, weight loss, fatigue, and night sweats. So as you can see, a lot of these symptoms, again, are often associated with the patient's underlying condition. And this is what leads to delay in diagnosis for so many patients, is that often their underlying condition gets investigated first to see if that is what's making things worse for them. So who gets invasive aspergillosis? Well, as I mentioned before, this is a real weakening of the immune system. This does not happen in our normal patients with things like chronic pulmonary aspergillosis or ABPA. This tends to be patients who are on cancer treatments, patients who have perhaps been in intensive care being treated for other conditions. And as we've certainly seen within the COVID-19 pandemic, we have seen invasive aspergillosis associated with COVID-19. Prior to COVID-19, we used to see invasive aspergillosis really associated with flu that landed people in intensive care. And also patients who have undergone an organ transplant. These patients tend to have significant suppression of their immune system to prevent their own bodies rejecting the new organs that have been given to them. And they are certainly at risk of this condition. So the symptoms of invasive aspergillosis are quite different. These patients are critically unwell and they are in hospital. There's a rapid onset of illness within hours to a few days and is associated with fever, breathlessness, cough, and then other symptoms as infection spreads to other parts of the body. Rapid hospital treatment is needed for these patients. Otherwise, the mortality or the death associated with this condition is very high. And lastly, Aspergillus bronchitis. So who gets Aspergillus bronchitis? Well, this can affect any patient with underlying lung disease. But the key here is that there is no evidence of tissue invasion, there is no lung destruction, and there is no significant allergy detected. So this is a separate diagnosis of exclusion. So when you have excluded the other diagnosis, we detect it by repeated isolation of Aspergillus from sputum samples, along with an immunological response that shows us they have an infection. Aspergillus bronchitis does not always require antifungal treatment, and those that do often just benefit from short courses of treatment. But like other bacterial infections or fungal infections, it can relapse over time and require repeated treatment. So my main message today, as will be the theme of today, I think, is to think aspergillosis. We really want ourselves as medical professionals and for patients to be able to really spread the word and to get people thinking about aspergillosis when they present with often just their normal respiratory symptoms. Testing is relatively easy and certainly quite easy to exclude a diagnosis of aspergillosis. So the more we can get the word out there and the more that we can get people testing and thinking about this condition, then the more patients we will be able to pick up at an earlier stage and offer them effective treatment. So I'd like to just thank everyone for listening, and I am happy to take a few questions.